inform my patient of the procedure, and I've disclosed and calculated the PI percent, which is 36%. Okay. So, if you can see this computer right here, going over your medical history is still no for all of these COVID screening questions. Go over the vitals, go over the general information. Note that she has had kidney stones and kidney infections, no allergies, and then she is on alprazolam for anxiety. Okay. Alright, and then, so to educate you on bacterial biofilm, so as you can see, all of this here is plaque. So biofilm can accumulate on the pellicle or on your teeth 20 minutes after brushing. Okay, and then the plaque hardens, can sit there and harden, turning into calculus, and that is like the deposit, the buildup on your teeth. And then also it can sit there and cause demineralization, which can cause cavities.
Oh, that's not good.
No.
I know a lot.
Okay, so the anxiety medication can cause dry mouth. Do you experience dry mouth?
Time to time.
Yeah, sometimes. So I need to go over, I did her EOIO, dental charting, and perio charting. So let's go here. You clench your teeth, bite cheeks and nails. Okay. And then
When I'm nervous.
when you're nervous.
Hence the anxiety medication.
Yes. Okay. Class 1, class 3 on the left side. Localized macules and a scalp tongue as well. I think that's all. Already said that. Okay. And then for the charting, go over the dental charting, and then as well as the perio charting. And then I noted that on her perio charting she had some localized BOP and one probing that was a 4 on the distal of 14 buccal. Okay, and then go over that. So, okay, so I think that the toothbrushing method that would be the most the toothbrushing method that would be the best for my patient would be the Stillman, the modified Stillman toothbrushing method. So show me how you brush your teeth.
On the side, on the tops.
Like that?
And go like this.
Okay. Okay, so now I'm going to show you how, okay? So just look in there. So what we want to do is we want to take the brush and angle it towards your gums, okay? And then just vibrate it a little bit like this and then roll up with it, okay? So like this, we're angling down, rolling up. Did you see how all of that came off? All right, so same up here, roll, and then you can even kind of go like vertical instead of horizontal if you need to reach these areas. Okay, and just kind of flip the toothbrush down. The more stuff you get on your mirror, the better.
Okay.
Okay. So now I'm gonna give you this floss. I want you to show me how you floss.
Can you hold that for me?
Yes. How often do you floss?
Like once a day or every other day.
Okay. How often do you brush your teeth?
Twice a day if I feel like it in the mornings.
Okay.
I get nauseous, so I don't try. I don't know. I might start doing it more without toothpaste, maybe.
Okay. Well, we want to brush our teeth 2 times a day, once in the morning, once at night, because, like I said, 20 minutes after you brush, it can start building up. And then, also we want to floss, every day as well. Okay. So I'm going to show you how. So you can wrap your floss around these 2 fingers like this. Okay. And always use a new piece of floss. Whenever you go through each tooth, you want to use a new piece of floss.
Okay.
Okay. So what you're going to do is that you're going to wiggle your way down. Okay. And then you're going to hug the tooth. Let's see, in a C shape, and you're going to move it up and down a few times. Okay. And then the same, go on this side of it, C shape, move it up and down. It kind of looked like you were just like popping it in and out really fast. So this is probably a lot better to get all of that off. Okay. Because you might could hurt yourself too. Do you ever bleed whenever you're flossing sometimes? Yeah. So that's good. So like that. Okay. So I want you to show me. First, show me the correct way to brush.
So at an angle and vibration, and then pulling down. And same thing down here and up. So do I do the same thing? On the inside?
On the
okay.
inside. On the inside as well.
And then you said right here.
Yep.
And then is it still vibration here and down? Okay.
Yes.
Okay.
Yep. All right. And then here's some floss.
So 2 fingers.
Okay. Maybe just a little more gentle. Okay. There we go. Oh yeah. You're getting
Better?
good.
Okay.
All right, and just take your time. And then I think what would be best for you is glide floss.
Okay.
It just kind of, like the name, just glides in there really easy. You can get it from like anywhere, Walmart, even the Dollar Tree I think has it. And then as well as, what kind of toothbrush do you use?
I just have a manual one.
A manual, okay. Is it soft bristle? Yeah. Okay. Maybe if you want to get an electric toothbrush, there's some more expensive options are like Sonicare, Oral-B, but they have just some cheaper ones as well. Okay. It'll just make it easier so that you don't have to, you can just kind of hold it and go around. Especially like you said, that sometimes you don't brush in the mornings, which we really do want to brush 2 times a day, but it would definitely get it a lot better. Okay. Let's see. So, and so also what I would recommend is Biotine mouth rinse. I can write all the stuff down for you, but Biotine mouth rinse, what it does is it can help with your dry mouth that you occasionally have. Yeah, that's all. Her oral hygiene diagnosis would be pretty much healthy. She doesn't have a lot of perio measurements over 4, and she doesn't have gingivitis or anything like that. Just a few oral hygiene things to perfect. And then as well as if you want to look at this,
Okay.
so this is just another thing like I already showed you, but how you need to have that floss like completely in a C shape so that it can go down and up under that gums.
Okay.
Okay.
And then, like water picks or like the floss picks, would you still want me? Would that be something I could get too?
Yeah, those I really like using the floss picks because it's it's easy, right? Like you can just do it with one hand. It's a lot easier. And then a water pick you could get as well. I would
just
definitely
have heard of
recommend
it.
Okay. Yep. And then yeah, those you shouldn't need.
Okay.
Because of the.
Oh, this is okay. So this
braces.
is the water flosser then. Okay.
Yep.
Okay.
And you just kind of, that one is obviously a lot easier. It doesn't take the place of like flossing, but it does help.
Okay.
Okay. So if you want to, you can just give me some feedback.
Oh. Well, you did very good. And answered all my questions. So that's good. Obviously real patients and circumstances, like they're gonna keep talking to you back and forth, and that's why I tried to do that.
Yeah.
Because they'll throw you for a loop when you're trying to go down your order of what you want to do, and then they'll ask you a question. It's obviously you have to consider your patient. So you did a really good job doing that.
Alrighty.